Well, we thank you for sticking with us this week because we here at Local on 2 have really tried to walk you through a variety of healthcare services. But sometimes when you need help, you need it now, and time is of the essence.
Which is why our next guest, Nathan Miller, provides immediate help. Thank you so much.
Yes, thank you so much for being here. You know, volunteer behavioral health care is able to connect people to a professional as soon as they call. Tell us how that works.
And that's absolutely correct. The way our system works is we have a centralized phone number, an access number, if you will. When people call that, then they are immediately connected with someone to do their assessment and their intake over the phone or through video. And then after that assessment is done, they will be connected through phone or video again with a psychiatrist or a nurse practitioner who can handle their mental health needs. And then after that medication is prescribed, if that's what's necessary, then we transfer them on to a care manager who will be following their case from there on out to assist them with any type of resources, whether it be in the community or just that link between them and the mental health center.
It's amazing.
It really and truly is. I was going to ask one question, but a good follow-up. We were just talking about if you don't get the help immediately, there are issues with people continuing to seek out that help.
And that's absolutely correct as well. During COVID, we saw a lot of people that had those barriers. You know, of course, a lot of places closed down, including some of our centers for a period of time. And what we developed was that same day access model and the no wrong door model. And basically that, you know, with them being able to call in that first day and get that help they need, they're not going to be able to walk away or think about it or change their mind and do something different, you know, because the stigma with mental health is really great. It's really heavy. And when people choose to get help, they need it right then. Prior to COVID, the system with most places was, you know, you call in one day, you have to wait a week or so for your appointment, and then, you know, so on and so on. Your med provider would be later. So it was a drawn out affair. This helps speed up that process, and we lose a lot less clients this way. Since we have implemented this program, our stats have went up roughly for that first time attendance, 30%.
Wow.
So that means 30% more people that call in are getting treated for that first time and continuing treatment.
Wow.
I mean, there is a reason why if somebody is holding an intervention for somebody and they finally say, yes, I'll go to treatment, they go then. Like, it's like, let's go. There's no thinking about it.
Right.
Or they have the opportunity to change their mind or freak out or whatever. So it makes total sense what you guys are doing. It's wonderful.
Yeah, it truly is. Let's say you notice some of the common signs, lack of motivation, sadness in someone you love. What's the best way to ask them if they need help?
Well, a lot of times to me, it's just be honest with them. You know, tell them that you feel that, you know, you're seeing these changes in their behavior, their changes in their mood, the issues that they may be having, the troubles they're going through. A lot of times when we see folks with depression, for instance, they may not be the first person that realizes there's a problem. Someone next to them may realize their changes in their behaviors and their actions before they do. And when someone else is helping you with that, it means that basically it's not going to get to the point of no return, so to speak, before you get treatment. You know, you're getting it early and you're getting it on time.
Wow. Now, when people call, I believe I read that they try to be connected to a mental health provider locally. How does that actually work? Like, how do you find your mental health care providers and connect them with people?
Well, our mental health providers work for volunteer behavioral health, so it's a system that we have established, like I said, since COVID or right during the period of COVID. So we have somebody there, you know, 8 to 5 every day, manning those phones, and it's a really neat system. It's kind of, you know, pioneering and pushing that model. There's not a lot of places that we have talked to similar to us that have that in place.
No, it's great.
I want you to talk more about that no wrong door policy. What does that mean?
Well, basically with the no wrong door, years ago, for instance, you had mental health issues and you had folks with substance abuse issues, which volunteer works with both of those. We refer to them as co-occurring disorders at this point. So years ago, the issue would be you call the mental health center and then you got for a substance abuse problem and they're like, no, we don't treat that. So nowadays, or vice versa, but nowadays that's not the case. We try to treat you no matter what your issue is. We connect you with the right person in our agency, or for that matter, if we don't have the right person in our agency, we will help you get connected with the person in a different agency that's going to better suit your needs, whether that's outpatient, inpatient, or whatever the case may be.
What does it bring to you to be able to be part of an organization doing such great work?
Well, I'm very proud of it. We've made a lot of strides. I feel like Volunteer, to me, is a leader in the mental health community, simply because of some of these programs that we've developed,
Yeah.
and continue to do that every day. So,
Thank you so much.
Thank you so much.
It really is. I hope that more communities, states, and it just ripples out, that they implement things like this, because it is true. So many people have a hard time with even asking for help, that when the time comes, you got to get to them in that moment.
We
So,
have to break
thank
that
you.
stigma.
Yeah.
We have to break that stigma.
Yeah.
Thank you so much
Thank you.
for what you
for having
do.
me.
Of course. And if anybody out there is interested, please call Volunteer Behavioral Health Care to set up an appointment. They also have a crisis line. That number is 1-800-704-2651, and you can visit them online at vbhcs.org.